With the announcement today, how is the scientific community responding? Is there evidence to support this hypothesis? I spoke with Dr. Richard Ferguson, president of the Black Physicians of Utah, and a partner on our segment, Health Matters on Midday, about the scientific evidence that the White House is using to make this connection.
I really think it could be very misleading and fear-inducing to many women that are pregnant now or about to become pregnant. But I can sort of understand what little fringe evidence, or should I say observational studies, is being used to support this hypothesis. It's just unfortunate that this is being done on a national scale that is going to cause people to lose possible trust in medicine, because I feel this is a form of misinformation. And this has actually already been explored even recently in very large studies. So this coming up again is very unusual. It's almost, I compare this to the same as someone saying vaccinations are causing autism, and that has been proven again and again. And even the study that stated that was redacted and told to be a poorly done study and wrong. So that's kind of how I feel of this. It's going to cause the jobs for us as physicians to be that much harder. And our jobs are already hard based on some of the rhetoric and the reach of our HHS secretary.
Many of us, when we get pregnant, we don't want to take any sort of medication and do our best not to do that. But is there a danger in telling women they shouldn't use Tylenol? I mean, is there something where they should be using Tylenol if they need it?
They should be using Tylenol. Now, I think that probably the best way to think about this is, let's just take a step back and say, why is Tylenol being used? Well, we use Tylenol to treat pain and fever. And even go a little bit granular here, if you give me a second, acetaminophen or Tylenol, it blocks a particular enzyme in our body that is in our brain and our spinal cord. And this enzyme produces another chemical called prostaglandins. And these chemicals, when they're released, when this enzyme is activated, it produces this chemical, prostaglandin, that causes the increase in pain and body temperature. And all that acetaminophen does, it blocks this ability of this enzyme to produce more of that factor, prostaglandin, to cause us to have lower pain and fever. So we have to remember, we're taking it for pain and fever. That's the indication. So, and it's one of the safest medications that's actually out there and has been studied. I think a lot of people don't, realize that there's not a lot of pregnant women raising their hand to be part of a double-blind, randomized controlled trial when their future child is at risk. But this is one of the medications that has been studied intently for some time. Particularly, I would cite one 2024 population-based study of nearly 2.5 million children. And it found that after controlling for what I would like to say familial confounding, and when I say confounding, that means anything that's external to the study. So an exposure to actually what's causing the fever. Was there an infection? And then anything else that would be outside of that study, genetics, that could be a confounding factor. But once you control for familial confounding, Tylenol use was not associated with increased risk of autism. That's 2.5 million children that were studied. And there's even a similar finding in a 2025 nationwide report that was with a birth study in Asia, where sibling comparisons occurred, and it showed no increased risk. And in some cases, it pointed an estimate in the opposite direction, meaning reducing, the risk of developing autism. So I think the key takeaway here is this drug has been studied intently for a very long time. And someone even brought forth the question of a linkage to autism. And when you take out genetics, environment, and infection, often some of the reasons not genetics being the reason, but infection being a reason why one may take Tylenol. When you control for all of that, there is no satiation to taking this and impacting your future child, or impacting your child in utero. So I really want people to just take a sigh of relief, take a deep breath. Although the president is going to come on right now, there is no scientific literature beyond a small association in two really small studies that we're highly susceptible to those confounding factors that are genetics and environmental influences that are probably more causal to an outcome of a birth, such as infection or fever, than actually the drug itself. And in those particular small observational studies that probably I can only assume maybe someone spoke to the HHS secretary about, but that is not the reason for autism.
Any final thoughts for us?
Trust your physicians. We go to medical school, PA school, even nurse practitioners. We are not taught opinion. We are taught many facts in medicine that are evidence-based, and they're repeated again and again. We do not take one small study and use that as some form of medical law. That is not how medicine is done. That is not what we practice to put, because you're putting often your lives and your baby's lives in our hands. And we do not take that risk lightly. So believe your provider, believe your obstetrician, your family doctor, your internal medicine doctor, your pediatrician, and that they know the evidence there to support your child taking Tylenol and your child in utero, and that there is no harm besides possibly to yourself and your liver if maybe you're drinking and have been taking alcohol during pregnancy. There's some mild risk there with elevating your liver enzymes, but overall, unless you have an allergy, Tylenol is one of the safest medications on the market to take, especially if taken prescribed. That's probably my closing statement. Trust your doctor. Trust the current scientific, well-based literature that's out there right now that your doctors, your PAs, your pediatricians, your nurse practitioners know to be safe for you and your unborn child.
Dr. Richard Ferguson is the president of Black Physicians of Utah.